Okay, hi, this is Dr. William O'Neill. I'm the medical director of the Center of Structural Heart Disease at Henry Ford Hospital and a practicing interventional cardiologist. There's a new drug, Repatha, that has been approved by the FDA as a brand new class of hypocholesterol drugs. Unlike statins, this drug acts by accentuating the numbers of LDL receptors that are present on the liver. The liver metabolizes all the cholesterol, and it's incredibly potent in lowering LDL. It's a sub-Q injection. You have to administer it either on a 2-week schedule or once a month. Really wonderful data. There's going to be outcome data presented at the ACC, which I think is going to be very positive. The only downside is that it's very expensive. It's $1,200 a dose, so typically $14,000 a year for a patient to use. And as a result of that, the insurance companies have been incredibly reluctant to approve use of the compound. Yeah, I have a family history of coronary artery disease. My father suffered a large myocardial infarction at age 47. My mother has coronary artery disease, and as it turns out, we suffer from familial hypercholesterolemia. So I was on Lipitor for about 10 years, and then all of a sudden I developed severe myositis. I couldn't move. I was basically paralyzed, and realized that that was the problem. 2 weeks after I stopped the Lipitor, I felt perfectly fine. But then I tried other statins, lower doses of statins, and nothing would work, because within 7 to 10 days of starting the statin, I would have severe excruciating pain and myositis. So for about a year, I wasn't on anything, and my baseline LDL was 262, which is really dramatically high. Very concerned about that, didn't have any symptoms, and I had coronary CTs done in 2002 and then 2006. And there was progression of coronary disease. Initially, I didn't have anything except for a little bit of calcium in my proximal LAD. And then on the test that was done in 2006, I had new progression with some left main disease and proximal LAD disease. And that really obviously alarmed me. I was really depressed because I couldn't be on any statins. And so then Repatha became available. I actually was a participant in the Osler trial, which is a randomized trial. I was initially randomized to placebo and took placebo for a year until I was on the active compound. And the active compound just dramatically lowered my LDL. The most recent LDL I have is 50. And with that, I've had no side effects, no muscle aches, perfectly stable. And it's very easy to use the drug on a once-a-month basis. So that all was perfectly fine while I was in the trial. While I was in the trial, I was getting the drug for free. But then as soon as it became commercially available, the study stopped, and then I had to go to try to get it approved. I have one of these Cadillac Blue Cross Blue Shield policies. I mean, it's outrageously expensive what my wife and I have to pay on a monthly basis for the insurance, and we've never been ill. So, we've been paying insurance for more than 40 years, and then when I go to get a prescription for this drug, I had 3 denials. Initially, they wanted to have me prove that I had that I'd had problems with the statins, and basically it took almost 5 months to get approval for the drug to be administered. I've tried a number of times on some of my patients to try to get the drug approved, and it's been like an absolute stone wall. I'm basically like 0 for 6 right now in getting any of my patients approved to take Repatha from the insurance companies, and the patients just can't afford it. It was really depressing, Steve, because I knew that my LDL was off the wall, and I was watching my CT scan and watching the coronary disease progress. And I know exactly what was going to happen. I had disease in the proximal LAD, which was the widowmaker lesion, and there's really no way to prevent it. And I really was extremely concerned that I was going to drop over dead. No, I mean, this has completely changed practice. I've been a practicing cardiologist for almost 40 years, and I was one of the first people to use amiodarone in America. I was one of the first people to use nifedipine. I've been on the forefront of advances of cardiovascular medicine and cardiovascular disease, and I know specifically what to prescribe my drugs. So now my physician professional autonomy has been completely destroyed because I can't prescribe to patients what I feel is their optimal therapy. And with a drug that is as powerful as Repatha to dramatically lower LDL cholesterol, I know that it's available, but the insurance companies won't pay for it.